30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levins can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levins has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levins' office today for a free consultation at 954-752-1020. That's 954-752-1020.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 6 p.m. Now, get ready for more Ask the Experts.
Happy Monday evening to you. I'm Rhonda Hines, filling in for Steve-O. And Dr. Levins, I have to tell you, I just got my air conditioning back after 2 days without AC. It just got turned back on an hour ago. So I'm pretty pleased to be doing the show with AC.
I'm happy that you have AC. You don't look sweaty at all.
The house was 87 degrees. Well, you should have seen me last night. Last night was horrible. I mean, the first night I had it, I didn't have it. It was rainy, so I got a little bit of a breeze. But last night I was a little bit irritable. I was like, oh, I can't breathe.
This is no time of the year to have no air. Yeah, absolutely.
Yeah, you can't do that in South Florida.
No, I mean, and you can't travel either. Like, you can't go to the mountains either right now. So, yeah.
Yeah, I know. Everything's kind of on a little bit of a lockdown, huh?
Yes, exactly.
So this is one of my favorite shows to do because I feel like the kind of surgery and procedures that you do bring people some joy, usually. I'm sure there's sometimes the difficult client, but for the most part, they're pretty happy to be having a procedure and doing something that's going to make them feel more confident and look better. Do you have a favorite procedure that you're I know you're good at a lot of things, but one that you're kind of a master of, or that you really feel that is one of your specialties?
I would say breast surgery is my number one surgery. I had an interesting patient today that I took care of who had implants from a long time ago. She had a nice result, but then she went through massive weight loss. So it's like a combination of things. And because of the massive weight loss, she ended up getting really droopy and kind of a very strange appearance. So we fixed her up about 7 months ago, and she was thrilled. We put in new implants, we changed the pockets, we made everything look good, did a lift. And I mentioned that because her skin is so loose, that she has the possibility that it could happen again because there's a loss of elasticity. So there's a product called Galaflex, and that is a dissolvable like mesh that lasts for a good 10 months to a year that you put in to support the breast, almost like a hernia repair. And I've been using it for patients that need it. And we talked about using it when we first got started, but there's a cost. And she said, oh, let's not do it. And lo and behold, today we had to reoperate on her because one of the breasts had fallen out quite a bit. So we redid the surgery and we put the mesh in and everything looks great. And I think she's going to be happy, and just a little bit of a regret that we didn't use it the first time, but go figure. So that was the case for today.
Yeah, I feel like implant surgery is one where most people are happy, particularly if they're flat chested, and they're not anymore. It's kind of a high success rate. Like, you can't go wrong as long as their body doesn't reject the implant, correct?
Absolutely. Yeah, breast augmentation procedures are very, very standard, very common, and relatively high success rate. The issues are such things as skin laxity, pregnancies, capsular contracture, implant issues. But there are definitely needs for there can be needs for revision here and there. And I mean, if any doctor says, "Oh, I never have any complications," and whatever, they're not being honest, because sometimes one's a little different than the other. So a lot of intricacies that need to be checked on. And but I feel very comfortable. I do a lot of breast surgery. One of them is breast implants. Other than that, there are breast lifts, reductions, combination lift and reduction with implants, breast reconstruction for cancer. I don't do that quite as much anymore, but that's certainly one of the procedures I do. And now
Why don't you talk?
go ahead.
Go ahead. Go ahead. Finish your thought.
No, I was just going to say that we've talked about this, but with various implant scares going on, that there are women that want to have their implants removed. They've had them a long time. Maybe they've had a couple sets of implants, and then what do you do with the rest of the breast? So there are shaping and lifting procedures, but if there's not sufficient volume, then sometimes you have to add fat to the breast. So these are different options that have to be considered.
So you have to do fat transfers. Do you usually get that from their love handles or their butt? Where do you
anywhere they can spare it. Yeah, the abdomen, the flanks, the thighs, and there's not 100% take of the fat. So that's another issue, is that you have to be prepared that not all the fat will take. It is living tissue, but sometimes you have to go back and do a repeat procedure, because you can't store the fat. Unfortunately, there's no way to stick in the refrigerator and just store it. That has not been figured out yet, because it's living tissue and it really can't be processed that way. That's an option for women that don't have enough of their own native breast tissue once the implant is removed.
Are you finding there's less scare with the implants? Because I remember at one time there was like you were talking about earlier, there was a huge concern. Do you feel like that's died down some, or do you feel it's still relevant?
I think it came back again last year, in the spring of last year, when there were hearings in Washington over the issue of I think we've talked about this. There's a condition called ALCL, which is a type of lymphoma. It's not breast cancer. It's from the lining around the implant, and certain textured implants seem to be implicated in causing that. Usually they've been in for a very long time. Those textured implants have now come off the market, but there are a lot of women that wonder, could they possibly get that condition with other implants? And then there's a whole laundry list of what's called breast implant associated illness. And this is big online if you look at it, that there are women that think that their bodies have been changed, their lives have been changed. There's not an awful lot of science, but most responsible plastic surgeons, like I think I'm fairly responsible, are trying to pay attention to it, not ignore them, and talk to about the issue of what the breast might look like removing it, what the options are removing it. And I've had a couple patients that have said, I feel better after it. But I mean, sometimes you see it looks like a miracle, where I think it's maybe some placebo effect as well.
Can you tell us more about the texture that was causing the ACL lymphoma, I think you called it?
Yeah, ALCL. Well, the specific manufacturer is Allergan, which I happen to use their implants a lot. And there's something called a BioCell texture. It was a certain type of texturing that was originally put on the implant to try to prevent capsular contracture. So that was one of the theories, that the scar tissue that can form around an implant is kind of confused by having a surface that's irregular and textured. So the body may not form that same type of capsular contracture. It really has never been proven that a textured implant will minimize capsular contracture, but it still was something that was commonly used. And now it was found out that that one particular type of texturing that one manufacturer used seems to be implicated in the very rare cases of this condition. And so now they're off the market, and the other manufacturers have different texturing, and texturing has kind of gotten a little bit of a bad reputation, just in case that were to occur again. Fortunately, the condition. Yeah.
Go ahead. Finish your thought.
Yeah, I was just going to say the condition is very treatable. Very treatable, the condition, if it does occur.
What year was that texture identified and taken off the market?
It was actually just taken off the market last year.
Yeah, just letting our listeners know, just in case if they're noticing something. I mean, they can come in and speak with you about that if they wanted to have theirs removed, and I guess try the fat option. But you're saying the fat doesn't necessarily take as well. Does
It
does
doesn't take
fat
as well.
in
It's
the
not as
face,
reliable. Yeah, yeah.
does fat in the
Good.
face take better than fat in the putting fat in your breast tissue?
No matter where you put it, there is a certain resorption rate. So whether it's the face, the breast, the buttock, it's not 100% survival. Whether it's 50% or 70%, there's a little bit of overcorrection that happens, and then a patient and a doctor need to discuss that if it doesn't work as well as either of them like, there might be need for a secondary surgery to add some more fat.
That's tough because you can't lose the fat when you try to, diet and exercise, and then when they try to put it back in their face, it just goes away. Or their
Exactly.
breasts.
Well, it's exactly right. It's exactly right. It's exactly right.
Do
It's
you have
unfortunate.
another? Do you have another procedure that you do quite a bit of that you feel that it's one of your specialties as well as the breast implants and lifts?
I think tummy tucks, abdominoplasty, very common procedure for me, and very high rate of satisfaction. For a patient that's had some children and some stretched skin and stretched muscles, and where liposuction is not going to be sufficient because it won't help the skin and the spreading of the muscles, the diastasis that happens with pregnancy. So that's where an abdominoplasty or tummy tuck becomes a necessary procedure.
How many hours is that procedure? Because I've seen some women who just, yeah, they break the diastin and just, they're obviously going to have to have some form of surgical repair to go back to normal.
It takes about 2 to 3 hours, depending on the patient. It's outpatient though. We do use a long-acting anesthetic. It's called Exparel, and that is like sometimes when you go to the dentist and they give you an anesthetic that takes longer, that lasts longer for your teeth. There's something called bupivacaine or Marcaine, so it gives you a 6-hour effect instead of just a 2-hour effect, and then it's in a slow release. So actually, it lasts over 3 days. We used to use pain pumps. The patient would have possibly delivering the anesthetic slowly and gradually in a little like bottle that they would wear on their side and deliver it. But now it's really not necessary anymore. Now that we use Exparel, which is that's definitely a good product. That's it's used in orthopedics and actually in dentistry also for pain control. It's very good.
Yeah, so no need to be afraid of the pain because you can control it.
Exactly. A few pain pills and then using the local anesthetic is very helpful.
Is it highly addictive like some of the other pain management meds,
No,
or?
it's not addictive at all because it's a local anesthetic. So because it's a
Oh,
local anesthetic, there's no dependency, and it wears off eventually, and it gives like a numbish feeling for a while, so it can really help to make it more comfortable for a day or two. And
yeah.
patients are moving around slowly. They use a recliner. We see them about 3 to 4 days after surgery, and then a week or 10 days, and by then you could be back to work, but moving slowly and no vigorous activity for about 6 weeks.
Yeah. Yeah, I had a friend who had like 5 kids, and it made a big difference. She looked really great afterwards.
It can be very dramatic. The thing that's interesting there is that sometimes you have a patient that has 5 kids and and their abdomen is totally flat, and then you have someone that has 1 kid, and then so it's very
Yeah.
variable. I mean, people stretch differently and age differently, and the weight loss, different areas of the body can be affected by weight loss. So it's
Yeah.
very variable.
Well, give folks your contact information and how to find you.
Sure. We're in Coral Springs, Florida, and our number is 954-752-1020. We also have an Instagram page, Dr. David J. Levins, and Facebook also, and a website, drlevins.com.
We're going to come back after this commercial break, and hopefully we can talk about lasers. You hear about so many lasers out there. How do you know which one is actually going to be worth your money? Without, because
Sure.
I've tried lasers before and, had mixed results. So maybe you can give us some tips.
Sure.
Okay, we'll be back right after this commercial break.